Welcome back to the world of anatomy and physiology. This is part 2 of the introduction to anatomy. Last time we talked about the terms anatomy and physiology and what they actually mean, how our bodies are organized, and a brief overview of the 11 body systems and which cavity they are located in. If you haven't seen that video, I suggest you go back and take a look at it. In this video, we will be finishing up the introductory information, usually the information that is kept in the first chapter of most anatomy books, and the terms which will come up very often in the world of anatomy. And one that shows up a lot is homeostasis, which is the maintenance of a relatively stable condition that ensures that the body's internal environment stays constant despite changes both inside and outside of the body. Basically keeping you at a very stable state. Some examples of the things that need to stay constant are blood pressure, body temperature, blood sugar, along with many others. And sometimes those conditions change. Take body temperature, for example. If we get too hot, receptors detect these environmental changes and relay that information to our brain, saying, hey, our body temperature is rising. The brain will then send a signal to effectors, which in this case are the glands that produce sweat. We sweat, and that brings our body temperature down.
Must have air.
This is called a negative feedback loop or negative feedback system. If there is a negative feedback loop, then there is a positive feedback loop. Unlike a negative feedback loop, where the conditions are reversed, a positive feedback loop, the conditions are enhanced. For example, when a nursing mother's nerves receive the stimulus of a nursing baby, these receptors will send a signal to the brain, which will send a signal back to the effectors, which in this case are the glands that produce prolactin, and they increase the production of this hormone, which produces more milk for the baby. Negative feedback loops reverse the condition. Positive feedback loops enhances. Some more terminology that gets thrown around in anatomy classes a lot are the anatomical directions and planes. The proper anatomical position of the body is face forward, arms out, palms forward. From this position, we will go over some major terms. Towards the cranium or head region is superior, not up. And away from the head is inferior, but we don't use the term down. So your heart is superior to your liver. Even if you're like Hank McCoy and hanging upside down, it still applies, so don't use up or down. Anterior is towards the front of the body, and posterior is towards the back of the body. So your sternum is anterior to your heart. The imaginary line that is dead center of your body is called the midline. And closer to the midline is medial. And further away from the midline is called lateral. So your lungs are lateral to your heart. Your limbs closer to the attachment point is proximal. And distal is farther away from the attachment point. Your wrist is distal to your humerus. Superficial is towards the surface of your body, and deep is away from the surface. Your ribs are superficial to your heart. Say you aren't standing but are lying down. If you face up, you are in the supine position. If you are lying face down, you are in the prone position. We, along with many animals, have what's called bilateral symmetry, meaning if you were to cut us right down the middle, we have an identical left and right half. Like Thanos after meeting Ultron in Marvel's What If.
Fascinating.
This is called the sagittal plane. If it is an unequal left and right side, then this is called the parasagittal plane. One of the greatest teachers of all time, Obi-Wan Kenobi,
Hello there.
taught Darth Maul about the transverse plane. You guessed it, superior and inferior halves. And if you were to cut the body or an organ into anterior and posterior halves, this is called the frontal plane or the coronal. and the plane that cuts at an angle is called an oblique plane. I hope this two-part series of the introduction of anatomy and physiology has helped, and be sure to use your phalanges to hit that subscribe button for more videos like this in the future. Until then, keep learning and keep discovering.